Mary George is a 45-year-old female that currently works as a dispute mediator. She has seasonal allergies that are well managed with Zyrtec, with spring being her worst season. She presents to the office today for a cough that has lasted for the last 7 to 10 days. She was in her normal state of health when her cough began 7 to 10 days ago, which she describes as constant and productive, usually with yellow-green mucus coming up, but occasionally pink. She is unable to perform her normal activities since this began and describes shortness of breath on exertion, especially when doing yard work, and also fatigue because she's unable to sleep due to the cough keeping her up at night. She states that there really isn't a time that is worse. It's always just constant. And she has found mild relief with an over-the-counter decongestant and ibuprofen. She took her temperature yesterday and had a fever. She also complains of decreased appetite, postnasal drip, wheezing, and bilateral frontal maxillary sinus pressure, but she denies chest pain or palpitations. She's never experienced this before, and so she's never been worked up for this. She does have a history of childhood asthma, but no longer needs an inhaler. She uses Zyrtec and an IUD for her medications, as well as the ibuprofen and decongestant. Her grandmother lived with her a few years ago and had an active TB infection, and she recently traveled to China 6 months ago. She was a 2-pack per day smoker but quit 15 years ago, and she has no allergies to medications. On physical exam, she's ill-appearing, diaphoretic, tachypneic, and febrile. Her blood pressure is 130/88, her heart rate is 100 beats per minute, and her respiratory rate is 22 beats per minute. Her temperature today is 101.5, and her BMI is within normal limits. Her nasal exam shows that her nose is erythematous and edematous with yellow-green mucus. Her TMs are pearly gray and intact with bony landmarks visualized. Her lymph nodes and her anterior cervical chain, she has mild lymphadenopathy, but they are soft, non-tender, and freely mobile. She has a normal heart rate and rhythm with normal S1 and S2 sounds. No murmurs, gallops, or rubs are heard on exam. There is decreased breath sounds over the left lower lobe, dullness to percussion over the left lower lobe, and increased tactile fremitus. However, there is no asymmetric expansion or retractions, and there's no increased anterior-posterior diameter, bronchophony, or egophony noted on exam. So in summary, the patient presents with a persistent cough that is impacting her quality of life. For the differentials, I'm thinking TB, influenza, or pneumonia. The most likely diagnosis is TB due to her recent travel to China and her grandmother who used to live with her. She also has nonspecific findings such as hemoptysis and a chronic productive cough. I'm also thinking influenza because it's very common, although it's coming out of flu season, and pneumonia due to the consolidation noted on exam. For her, I will go ahead and consult a TB doctor to see if the patient needs to be admitted, order a chest x-ray, and perform a skin test. Based on the results of that, I will either send a referral for a TB specialist to go ahead and get her started on antibiotic therapy, or I will have her follow up with me and treat her for influenza or pneumonia depending on what the chest x-ray shows.